Hey everybody, welcome back to the knowledge is power type of video. If you know me, you know that I love to educate people on herbal and being able to take care of themselves, but also, what these drugs that your doctor is giving you, what are the side effects? Like, what are you going to be living with if you choose to take this drug? So the other day I was in a physician's office, and I grabbed a couple pamphlets of some medication. I've got like 5 over there, and we're going to end up going through all of them. They also have the reactions to them. Like when I tell you it's pretty thick. It's pretty thick. Wow. So this one's Cobenfy. Cobenfy? Don't get me to lie. It's because schizophrenia shouldn't change who you want to be. Welcome to what could be. Cobenfy. There's the front of it. Now it does state, it has this on the inside. It has a little QR code. In 2 clinical studies, Cobenfy showed proven significant symptom relief versus placebo, a sugar pill, if you didn't take anything at all. Overall improvement across a range of symptoms. Positive symptoms like hallucinations and delusions. Negative symptoms, lack of interest or emotion. Cobenfy was studied in a 2 5-week clinical studies. Only 5 weeks. Studies with 470 adults aged 18 to 65. Diagnosed with schizophrenia. Participants either took Cobenfy or a sugar pill. Individual results may vary. A schizophrenia rating scale was used to compare meaningful changes in symptoms overall. These symptoms include positive, negative, and general psychopathological symptoms. Selected important safety information. Before taking Cobenfy, tell your healthcare provider about all of your medical conditions, including if you have an enlarged prostate, problems passing urine, or a blockage in your urinary bladder. Have liver problems, have or have had gallstones. Well, I had my gallbladder took out. Or problems with your bile ducts or pancreas. So if you're a drinker, and have issues with your pancreas. Have stomach or intestinal problems. I know a lot of people that have IBS problems. So if you got stomach problems, this can make your stomach problems worse. Including constipation, ulcerative colitis, slow emptying of your stomach, or myasthenia gravis, myasthenia, gravis, gravis. And then it goes to the next page. But what strikes me is they only did a 5-week. 5-week. They did 2 of them, so a total of 10. It was only 5 weeks to see what this medication would do. To me, that just doesn't seem long enough to see what true symptoms, positive or bad, are going to be. In one clinical study, Cobenfy reduced the overall severity of schizophrenia. A different schizophrenia rating tool was used to evaluate meaningful overall changes in the severity of schizophrenia. And it asks if you're interested in learning. It's got a QR code. Select important safety information. Before taking Cobenfy, tell your healthcare provider about all of your medical conditions, including if you continued have an eye condition called narrow angle glaucoma, have kidney problems. So if you have glaucoma, narrow angle glaucoma, or kidney problems, you need to make sure you talk to them. Please see important safety information throughout and full prescribing information, including patient information providing in the pocket. I'm going to go to the next page. Comfrey is not an antipsychotic. It works differently. Comfrey is a different approach to schizophrenia treatment. Comfrey is a unique combination of two medicines. I'm gonna just spell it because I'll murder it. XANOMELINE and TROSPIUMCHLORIDE. Hold on one second. Georgia, quit! Sorry, she was doing something she wasn't supposed to. And the X medication is thought to activate the muscarinic muscarinic receptors in your brain to help adjust important chemical messengers related to schizophrenia symptoms. And the trospium chloride may help prevent the other medication from working outside your brain so that other parts of your body are less likely to be impacted. The exact way Comfrey works is not fully understood. So they really don't know how exactly this medication works. So, and they only did 2 5-clinical-week studies. Comfrey is the first and only FDA-approved schizophrenia medication that is thought to work by activating specific small proteins in the brain called muscarinic acetylcholine receptors. And it also says down here, receptors are small proteins or small structures found on the cells in your brain and body. Contained medicines can interact with receptors to activate them. This may change how your cells function. So this medication can change how your cells function. Okay. The muscarinic receptors are types of receptors. Select important safety information. Before taking Comfrey, tell your healthcare provider about all your medical conditions, including if you continue, and this is continued. So they don't put it all on the same page. Like, if you don't look for it, like they have spread out the warnings on 3 pages. Are pregnant or plan to become pregnant. It is not known if Comfrey may harm your unborn baby. Tell your healthcare provider if you become pregnant or think you are pregnant during treatment with Comfrey. So it talks about this gentleman on Comfrey, how it helped him. There's also some more warnings over here. It said select important safety information before taking Comfrey. Tell your healthcare provider about all your medical conditions, including, and this is continued, there is a pregnancy exposure registry for women who take Comfrey during their pregnancy. The purpose of this registry is to collect information about how the health of the woman exposed to Comfrey and their baby. If you become pregnant during the treatment of Comfrey, your healthcare provider will register you by calling 1-866-961-2388 or online at womensmentalhealth.org. Research pregnancy registry. Antipsychotic is right there. I will put it in the links below. And if you are breastfeeding or plan on breastfeeding, it is not known if Comfrey passes into your breast milk or if it can harm your baby. Well, if it's going into your cells, it's modifying how your whole body works. So I'd just be very careful there. But on every page it has warnings. Like, it had a warning here, warning here, warning here, warning here. Possible side effects of Comfrey. Most common side effects experienced by 5% or more of the people taking Comfrey. Nausea, 19%. intensified due to 4% in the sugar pill. Stomach upset or burning, 18% versus 5% on the sugar pill. Constipation is up 17%, 7% sugar pill. Vomiting, 15%, 1% with sugar pill. High blood pressure, 11%, 2% with a sugar pill. Stomach, abdominal pain, 8%, 4% with a sugar pill. Diarrhea, 6%, 2% with a sugar. Increased heart rate, 5%. Dizziness, 5%. Heartburn, 5%. These are not all the possible side effects, it says as well. Your healthcare provider may lower your dose or stop treatment with Comfrey if you get certain side effects. So make sure if you get this medication that you ask for a brochure so you can know exactly what you're going to be expecting. People take Comfrey had similar rates of uncontrolled facial or body movements and 2% as those taking the sugar pill was -1. Select important safety information. They go on to continue. Comfrey may cause serious side effects, including problems with emptying your bladder, urinary retention. Risk in people with liver problems, risk in people with bile duct and gallbladder problems, biliary disease, slow emptying of your stomach, serious allergic reactions, eye problem called narrow angle glaucoma, increase in heart rate, side effects in people with kidney problems and central nervous system problems. Now it goes on. First instance of nausea often occur during the first 2 weeks of treatment and generally decrease over time. And now remember, they only did this study 2 times for 5 weeks apiece. I got that on my finger. But anyway, it gives you a little graph here. And then it says eating food too close to taking Comfrey can make side effects worse. So this is one medicine that taking medication with will cause the side effects to be worse. So you want to make sure you maybe take this on a empty stomach. And the sugar pill average change in 5-week study was 4.96% of weight gain. In Comfrey, an average change in 5-week studies was 3.04 pounds of weight gain. Comfrey average change in 1-year studies didn't it just say up here that they only did 2? Georgia quit. I could have swore. Yeah, Comfrey was studied in 2 5-week clinical studies with 470. But then it says here that average change in 1-year studies was a 5.64 pounds of weight loss. So that's kind of a little bit contradictory to what it says to the first page, because it says they only did 2 5-week things. The results are from 1-year studies where the participants and their physicians knew they were taking Comfrey, which may have influenced the results. On average, participants lost 5.6 pounds in the year-long trial. 17.6 of the participants had decreased in body weight they lost 7%. 4.1% of participants had an increase in body weight. And it says start and end your day with Comfrey. So it wants you to take it twice a day on an empty stomach. Twice a day on an empty stomach. You're going to take it in the morning. You're going to take it at night. Talk to your healthcare provider about how to add it to your daily routine. They do have different milligrams. The different milligrams is the starting dose. It says Comfrey comes in different strengths. So starting dose for at least 2 days is 50 milligrams to 20 milligrams. And when starting Comfrey, the recommended dose is 50 milligrams / 20 milligrams twice daily for at least 2 days. And increase dose for at least 5 days to 100 milligrams, 20 milligrams twice a day. And then it's going to up you. You're going to have 100 milligrams and 125 milligrams. And you're going to take, I don't know how they will determine the correct dose, but here it is. They have multiple doses. What I would like to see is a study done on all the side effects. They listed the side effects, for weight loss, because it was maybe positive, but in that year, what did it help benefit other things too as well? I'm not seeing that in here at all. Just make sure, guys, that you're asking questions. Be knowledgeable when you're putting a medicine in your body. At the end of the day, I'm a huge health, nut when it comes to learning how to heal your body naturally with what God put here. And, I am still learning, and I am not, these meds, you just got to be careful because they have a lot of side effects. And I'm not saying don't get help for your mental health. That's not what I'm saying at all. But just know the side effects of said medicine. Because sometimes people start some medicines like this and their mind goes crazy and they're like, oh my God, I can't deal. And they don't realize it's the medicine. So learn how to speak up and carry, when you're doing a medicine like this, do a daily diary of your emotions. So that way you can look back and see how you're doing. You know what I mean? So that way, if you just don't notice it, if you write it every day, how you feel in a book, that way you can go back, how you felt that morning, how you felt that evening, how you, wherever, notice the mood change, etc. Write it down. So that way you can take it to your healthcare provider and be like, here, this is how I felt, and you can look back on it. But it also says here, consider your schizophrenia symptoms. It's important to understand the different types of symptoms you may be experiencing so that you can discuss them with your healthcare provider, okay? Positive symptoms are additional experiences that your brain creates, okay? Hallucinations, seeing, hearing, feeling, tasting, or smelling something that is not there. Delusions, holding beliefs that are not true based on reality, difficulty thinking or speaking. Dakota. Sorry, gentlemen, ladies and gentlemen, I got interrupted. That needs to be done in here, okay, darling? Alright, well, you can do it in there, but that's it. Negative symptoms are missing pieces of your usual self. Like, things that used to be there that are not there. You want to make sure that you're not missing the old part of you. And don't log me out. Please. Negative symptoms are like missing pieces of yourself. Don't go saying you got to rewrite who you are. No. Some things you need to keep. Some things make you on the other side of that screen, okay? They make you. Difficulty staying motivated to complete tasks. Decreased sense of joy or happiness. Showing little emotion, not smiling or use a facing expression. Social withdrawal, okay? If you're doing any of those things, speak up. Be like, hey! At the end of the day, I know it's hard. We live in a society where everybody's got to have the best of everything and da-da-da-da-da-da-da-da. But I'm going to be really honest with you. Since I started giving my worries and cares to the Lord, I do battle with mental health issues. And at the end of the day, I'm, thankful that God has brought me through, 7 years clean and, trying to, navigate, I have a lot of things going on in my life and trying to remain sober through those things and keeping on the positive path and educating people about what's around them in their life, and it's the things like this that you need to be educated about, because just because the doctor says it's good for you doesn't always mean that it is, okay? Cognitive symptoms affect how you think and process information. Trouble with memory. Like, did you start this medication and have trouble with memory? If you did, be like, hey, doc, something wrong with my TikToker up here, you know. Difficulty understanding and making decisions. Okay? If that occurs, be like, hey, doc, got an issue going on here. Need help. Okay? And then difficulty paying attention. I have that problem already. Anywho, this is not a complete list of symptoms, and everyone living with schizophrenia experience symptoms differently. It also goes on in here to give you some other information about Cobenfy. And they got a copay assistance program. It goes on to have other important safety information. May cause serious side effects, including what we talked about this: difficulty urinating, urination in a weak stream or drips, urinating frequently, full bladder, and difficulty emptying your bladder, pain when you go pee-pee, yellow. Okay. Oh, risk if people with liver problems. Do not take Cobenfy if it's you. So it can, if you have liver problems, this is a huge no-no for you. So if you know somebody that has mental health problems, schizophrenia, and they are looking into this med, this is a huge no-no. It's a huge risk right here. Huge, huge risk. Do not take it if you have liver problems. And it just going on to talk with, you know, if you have all those other issues. It also says serious allergic reactions, hives, swelling of your face, lips, mouth, or tongue, swelling of your throat, hoarseness, or difficulty speaking, breathing problems. Cobenfy may cause serious side effects including eye problems, red eyes, blurred vision, seeing halos or bright colors around lights, eye pain or discomfort, nausea or vomiting, severe headache, increased heart rate, kidney problems, nervous system problems. So there's a lot of side effects with this. They give you a little section right here to write about. Right quick. They give you a little section right here to write on. But just be mindful, guys. I'm going to do a part 2 because this is already 22 minutes long. But this is the insert. I haven't even got to the insert yet. So I haven't even got to the fine print. And this is the fine print. This is how they make it. Okay? And these are, just also certain things that's where there. But here's the molecule makeup of one of them. And it's very interesting, ladies and gentlemen, and I'm all for healthcare, but I'm all for a medicine helping you and not causing 1,001 effects from it, okay? I'll just be honest with you. If I'm going to take a medication that's going to cause me 10 more problems down the road, to me, that's not a win for me. But I just want y'all to be educated. You know what I mean? I want you to be educated, and I want you to know. So when a doctor gives you a medication like this for mental health, always ask for a brochure. Always ask for a brochure. Always ask to go over those mental health medications with your psychiatrist and your therapist. Make sure everybody on your team is aware of your medication, what you're taking, how you're taking them, so they can be mindful and be able to look for things that need to be looked at, in case you're showing side effects that you don't necessarily see. But anyway, guys, I love you so big, so much. And remember, God loves you, and I do too. Peace out.